Underserved rural and semi-rural areas still contribute to the overall high neonatal morbidity and mortality in India. Lack of clinical talent and timely intervention is still one of the biggest reasons for India's high neonatal mortality rate. When it comes to saving a little one, distance should never matter. Motherhood Hospital initiates an innovation to bridge the gap and is bringing its NICU expertise near you, powered by technology. Presenting NICU Live.
To witness a very interesting development field of neonatal intensive care that's being delivered from motherhood. As all of you are aware, Motherhood Hospitals over the last 7 years has been in the forefront of neonatal intensive care program. We have probably the largest network of neonatal intensive care beds in the country.
Good morning, Dr. Pratap Chandra, neonatal lead, Motherhood Hospital. So basically, when we go around and treat these babies all over India, because we have one of the largest NICU, the bed infrastructure in India, we realize that in the remote areas, this facility is not available. ಈ ಥರ ಒಂದು infrastructure ಆಗಲಿ, ಈ ಥರ trained doctors are not available. Not just the doctors may be there, but you don't have enough number of nursing staff illa, both in terms of the staffing, in terms of the infrastructure. It is very poor. Yak bejaragate, why do we feel really let down from all these problems is that almost 7.5 lakh babies die every year in India. And India contributes to the world mortality highest number of deaths. So 1/5 of all the babies, like out of 100 babies that is born, 20 babies are born from India. Okay, and of the 100 babies which die all over the world, 25 are from India. So ishtu high level of mortality iddaga, what are we doing? So pockets of care is absolutely brilliant in India. ಕೆಲವೊಂದು ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ತುಂಬ ಚೆನ್ನಾಗಿದೆ, ಹೈದರಾಬಾದ್, ಡೆಲ್ಲಿ. ಬಟ್ ಇಫ್ ಯು ಗೋ ಟು ಜಸ್ಟ್ 40-50 kilometers from these cities, this care is not that brilliant. So ಇವಾಗ ಏನು ಮಾಡಬೇಕು? Then we were trying to find out a solution for it. Then we said, okay, we will do neonatal transport. So we established one of the largest transport systems where we go and bring the babies from remote areas. But that also has a problem because alinda barbekandre they need the money. You'll band papa ellirtare, hotels alli irbekagate, and you're separating the mother and the baby. And also, what is the confidence of the doctor looking after those babies in that remote areas? So then we came up with this innovative solution called NICU Live. So NICU Live alli en martivi, we Mr. Vijay has explained to you in detail one hub space irutte, which is in Indranagar right now, so where Motherhood Hospital is there. So that is one of the largest tertiary centers. So illen martivi, there is a trained nurse, there's a trained doctor. On top of it, you have a neonatal consultant. So you istu jana serkondo, they will remotely monitor these babies. So ನಾವು ಈ ಒಂದು ಸ್ಪೇಸ್ನ ಹಬ್ ಅಂತ ಕರಿತೀವಿ, ವೇರ್ ವಿ ಮಾನಿಟರ್ ದ ಬೇಬೀಸ್. ಇಟ್ಸ್ ಕಾಲ್ಡ್ ದ ಸ್ಪೋಕ್. ಸೊ ಇಟ್ಸ್ ಲೈಕ್ ಎ ಹಬ್ ಆ್ಯಂಡ್ ಸ್ಪೋಕ್, ವೀಲಲ್ಲಿ ಒಂದು ಹಬ್ ಆ್ಯಂಡ್ ಸ್ಪೋಕ್ ಇರುತ್ತಲ್ಲ, ದಟ್ ಸಾರ್ಟ್ ಆಫ್ ಎ ಮಾಡೆಲ್. ಸೊ ಇಲ್ಲೇನಾಗುತ್ತೆ, ಅಟ್ ಎನಿ ಗಿವನ್ ಪಾಯಿಂಟ್ ಇನ್ ಟೈಮ್ ವಿ ಆರ್ 24/7 ಲುಕಿಂಗ್ ಆಫ್ಟರ್ ದೋಸ್ ಬೇಬೀಸ್. ಸೊ ವೆನ್ ವಿ ಸೆಟ್ ಅಪ್ ಇನ್ ದ ಸ್ಪೋಕ್ ಏರಿಯಾಸ್, ವಿ ಸೆಟ್ ವೆರಿ ಹೈ ಪ್ರಿಸಿಷನ್ ಕ್ಯಾಮ್ರಾಸ್. ಅದು ಯಾವ ಥರ ನೀವು ಝೂಮ್ ಔಟ್ ಮಾಡ್ಬೋದು ಅಂತಂದರೆ, ಝೂಮ್ ಇನ್ ಝೂಮ್ ಔಟ್, ಯು ಕ್ಯಾನ್ ಲುಕ್ ಎಟ್ ದ ಪ್ಯೂಪಿಲರಿ ರಿಯಾಕ್ಷನ್ ಆಫ್ ದ ಬೇಬೀಸ್. ಅಷ್ಟು ಹೈ ಪ್ರಿಸಿಷನ್ ಇದೆ. ಆ್ಯಂಡ್ ದೀಸ್ ಕ್ಯಾಮ್ರಾಸ್ ಆರ್ ಇನ್ ಟರ್ನ್ ಕನೆಕ್ಟೆಡ್ ಟು AI technology, machine learning and big data. So these three things are going to rule the world. So we thought, why not use the technology to help these babies survive more? And then India, the mission of India is to bring down the mortality to single figures. Yesterday almost 28 babies are dying out of 1,000 live births in India. So idana ನಾವು single digit ತರಬೇಕು. as compared to, for example, UK has 1 to 2 deaths out of 1,000, live births. So ಈ ಥರ ನಾವು ಮಾಡಿದಾಗ technology we thought we will utilize, and we found a platform called the radar platform. So ಇದರಲ್ಲಿ ಏನಾಗುತ್ತೆ, the machine is going to learn in such a way that ನೀವು ಅಲ್ಲಿ ಮಾನಿಟರ್ಗೆ ಝೂಮ್ ಮಾಡಿದ್ರೆ you will get all the data entered in here. You don't have the nurses to keep entering.
ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೆ. ನನ್ನ ಹೆಸರು ವಿಜಯರತ್ನ. I am the CEO of Motherhood Hospitals. Today we are gathered here to discuss a very important advancement in the area of neonatal intensive care given to the newborns. NICU Live, as we call it, is a new concept which uses technology to treat children who are far in the remote areas. This is a concept that we have been working on for almost close to a year now. We have now about 30 NICU beds being managed across different parts of this country and have treated more than 300 children through this technology. And the results are brilliant. And we have been able to save and do a very, very good treatment and discharge these children much earlier through the technology and the treatment protocols that have been laid down exclusively for treating these children through the remote concept that we have. We are extremely happy with the outcome, and we are looking forward to taking this entire technology to a much wider and larger part of this country and make a difference to the treatment of newborns who really, really need the care and the advanced care that currently available only in probably the metros and A-class cities of this country. But I think this technology will help us to take a similar level and standard of care to very remote areas and help children do well. Currently we have the NICU Live program running in places like Hindupur, Anandpur, in Bihar, and even in a place in Punjab called Hisar.